gum disease, gingivitis, and reseeding gum lines. This is not a small problem. In fact, guess now, how many people in the general population do you think have it? What percentage? Comment in the comment section below what your guess is. And spoiler alert here, add about 30 percentage points to what you think, because gum disease affects roughly 70% of all of us. That's the number. That's not even the scariest part though. Here it is. Most people have no idea they even have it because it doesn't always hurt at first. It just quietly spreads. And it's not just a mouth issue. It's actually a whole body inflammation signal. Yeah, sure, it can age your lower face fast. We know that. Recession of gums, longer teeth, that collapsed lower face look. But the real danger? Well, it's what it's broadcasting to the rest of your body. You see, and this is what actually shocks my patients, gum disease isn't just in your mouth. Let me first take you through 3 of the top ones you need to know about. You want studies, right? Well, a meta-analysis shows a 34% higher risk of future cardiovascular disease, heart disease, in people with periodontal disease. Yeah, heart disease is what you're thinking, the number 1 killer of both men and women around the globe. Also, periodontitis or gum disease and diabetes move together, meaning a 2025 meta-analysis reported gum disease and gingivitis is associated with a 26% higher risk of diabetes. 26%, colossal. Here it is here, you can see the conclusion from a 2023 study. Simple measures of oral health were associated with the risk of developing diabetes, demonstrating the absolute importance of oral health screening for diabetes prevention. We all want prevention. Now, I don't need to go in and tell you the problem that diabetes and high sugars has for your body, for your skin, glycation, for your heart attack, and for your brain and just about every end organ in your body. You know that already. And before we move on to the brain, consider this test. Do this right now. It's called the tongue sweep test. Run your tongue over the front and back surfaces of your teeth, particularly focusing near the gum line. That's the key area. The result, your teeth should feel as smooth as glass. If they feel fuzzy or rough, kind of like they're wearing a sweater, that's called biofilm, and it's usually bacteria involved. You know it as plaque that you missed and that causes gingivitis. So now I know you're asking, the mouth-brain link, doctor, what's that? Well, it's real enough to measure now. In fact, a meta-analysis found gum disease is associated with Alzheimer's disease. Look at this, with an odds ratio of 1.67. That simply means people with gum disease were found to have about a 67% higher odds of having Alzheimer's disease, compared with people without periodontal disease or gum disease, 67%. To be clear, what it doesn't mean, it doesn't directly mean gum disease causes Alzheimer's, or everyone with gum disease will get dementia, or treating gums prevents Alzheimer's. But here's what it does mean. Gum disease is acting like a measurable risk signal. Think of it like this. If 2 people are otherwise similar, the one with chronic gum disease shows up in Alzheimer's statistics more often. Not once, but consistently enough to measure significantly. So we now know the question isn't, does gum disease matter? The question is, what do you do about it? Now this bar graph here is going to be interesting for you. Look where you fit in at the bottom by age, and then follow it up and you'll see your risk. Stop the video here and see where you lie on the curve. Just stop and look on the graph and see where you sit. So a natural, non-invasive way to address this, natural red light therapy and near infrared. And it's reusable in at-home versions. So when you get these kind of devices, you can use them time and time again. There's no consumable that you have to keep paying for. Very inexpensive. The cost per use is there. It's great. Now there's in fact hundreds of published papers looking at red and near infrared light for the oral cavity. Most people don't know that that's the case. Hundreds, not influencers, not trends, actual dental and medical literature. This falls under what we call photobiomodulation, low energy light used to influence cellular function. Not heating the tissue, not scraping the teeth. I hate that when you go to the dentist and they scrape. Cavity causing. Not picking at plaque with a pitchfork. But photobiomodulation, light that affects change gently. So what are the wavelengths most studied in gum disease and oral tissues? Well, they are red light, so 630 to 660 nanometers. You can see that with the human eye. And then near infrared, 800 to 980 nanometers. That's outside of the visible range that you can see. These wavelengths are absorbed by the mitochondrial chromophores, most commonly discussed as cytochrome C oxidase. I have complete videos on exactly how red light works, but when this happens, cellular energy production increases, inflammatory signaling is modulated, so the inflammation is decreased, and microcirculation improves. All good things. Interestingly, most periodontal studies use very modest energy densities in the range of about 1 to 10 joules per square centimeter, so quite low. And that's really cool for us because that means you don't need some high power in-clinical laser. You can use an at-home device. Now, what does the data actually show in science? Number one, a randomized controlled clinical study published in Lasers in Medical Science evaluated red light therapy used as an adjunct to scaling and root planing. That's where they use an instrument in patients who already had periodontitis, gum disease. The group receiving photobiomodulation, the red and near infrared light, showed greater reductions in gingival inflammation. So they improved with the light versus those who didn't have the light. And also bleeding indices went down compared to those who only had the scaling done. They looked here in this case at 30 patients with chronic gum disease. The follow-up was at baseline 1, 3, and even 6 months. So a really good time frame. Number two, a systematic review published in the Journal of Clinical Periodontology reviewed multiple trials using low-level laser or LED therapy alongside conventional treatments. Here they use wavelengths of 650 to 700 and 808 to 980. So what did this one show? By the way, we like review articles because that looks at a number of articles all at once. Well, they concluded that photobiomodulation significantly improved clinical inflammatory parameters when used as an adjunct, not a replacement for the standard of care, but along with it. Number three, another lab study examining human gingival fibroblasts. You're going to know fibroblasts because that's what's in your skin producing collagen and elastin, your bounce. So they exposed these cells to red and near infrared light, and they showed reduced oxidative stress and improved cellular viability at the low energy doses I mentioned, supporting the biological plausibility of the clinical findings we see. Meaning this showed a mechanism for what we're seeing in real life, but on a cellular level. Another data point for you. In this study, there were 12 donors, 6 male, 6 female, so 50-50, age 25 to 48, and the wavelengths used here, 635, your red light, and 808 nanometers, that's your near infrared, a combination. The dose used, 100 milliwatts. The energy density was 4 joules per centimeter squared. The treatment schedule, just 4 sessions. When were the effects most seen? After the 3rd session, so it didn't take long. So the bottom line with these studies is across the board, the pattern is consistent. Reduced bleeding, reduced swelling, improved healing, better tolerance after procedures. This does not replace brushing. Keep that in mind. It doesn't replace flossing. It doesn't replace professional dental care. But I can tell you for me, it's reduced greatly the number of visits I need. And when I go in for my cleanings, everything looks great. They're like, oh, weren't you just in here? It looks perfect. Prevention, that's what we're all trying to do. Remember, pathogenic oral bacteria thrive in inflamed, low oxygen, low circulation areas. That's why red and near infrared light have been so well studied for post-tooth extraction healing. When people get the teeth removed, they use red light to help everything heal up. Remember, the oral cavity is one of the dirtiest of all animals on the planet. So when you take a tooth out, you want to do all that you can to prevent infection, because the bacteria in our mouths are just that. They're potent. Red and infrared plays a role in that healing. Good news is this is no longer a fringe concept. Photobiomodulation is actually now taught in dental and medical continuing education for a reason, because there's hundreds of studies. So when people ask why I care about the mouth so much, this is exactly why. The oral cavity is one of the most vascular, metabolically active regions of the body. Chronic inflammation here acts like a slow leak of inflammatory signals into your bloodstream. You may not feel it, but your body responds to it. And if you care about aging, inflammation, heart health, and long-term wellness, well, ignoring gum health, that's a blind spot you have. That's, my friends, what the science actually says.